In this video, we are going to discuss the different movements and activities that may take place within the bathroom. When completing daily activities in the bathroom, it is important to follow your hip precautions to ensure that your hip will heal properly. First, we will discuss how to get on and off the toilet. It is important to note that the height of your toilet may impact your ability to transfer on and off of the toilet. The higher that your toilet seat is, the easier it will be to maintain your hip precautions and get on and off the toilet after surgery. In order to increase the height and safety of your toilet, you can purchase grab bars, a toilet donut, a commode chair, or a toilet seat with handles. These pieces of adaptive equipment can make transferring on and off of the toilet easier for you. In order to get onto the toilet, it is important to back all the way up to the toilet, ensuring that the back of your legs are touching the front of the toilet seat. Once you are close enough to the toilet, you will then reach back to the toilet seat and slowly lower yourself onto the toilet. If you have a lower toilet seat, it is important to kick out the surgical leg and extend it in front of you to ease the amount of hip flexion that you have. Once you are ready to stand up, you will want to push up from the toilet seat or handles to stand up. If this is difficult due to the height of your toilet, it may be helpful to have someone help you stand up from the toilet. If you are using a walker, it is important to push up from the toilet seat or grab bars and not grab the walker to pull yourself up. When first taking a shower or bath at home, there are many things to remember. First, it is important to check with your doctor to see how long you should wait before taking a shower. The amount of time that you should wait may depend on the type of dressing you have or a multitude of other factors. If you do not feel comfortable getting in and out of the shower, there are alternative ways to clean yourself, like taking a sponge bath, that can be used until you gain more confidence with this skill. To start off, it is important to determine what type of shower you have and what equipment you have available to you. This is because the way that you get in and out of the shower will depend on what type of shower you have and what equipment you have. There are two types of showers. The first one is a walk-in shower, and the second one is a tub shower combination. We will go over how to safely get into a walk-in shower first. One way you can transfer into a walk-in shower is sideways. To use this approach, you will walk up to the outside of the shower and turn yourself so that the hip you had surgery on is not facing towards the shower. Next, you will let go of the walker and reach for a grab bar or a shower wall. Then you will lift your non-surgical leg into the shower and step up into the shower like so. Finally, you will carefully lift your surgical leg into the shower. The second way you can enter a walk-in shower is to go backwards. This approach can be used with a walker or a rollator. First, you will carefully back up to the edge of the shower. Next, you will step backwards into the shower with your non-surgical leg first. Then, you will lift your surgical leg into the shower. When exiting a walk-in shower, you can use a grab bar or grab your walker on the outside of the shower. Once you are steady, you will step down out of the shower with your surgical leg first and then follow with your non-surgical leg. If you have a tub or tub shower combination at home, the approach to entering the tub will be slightly different. Now, we will go over how to enter the tub if you have a tub or shower chair. First, you will back up to the edge of the chair, ensuring that the backs of your legs are touching the front portion of the chair. Then, you will reach back and slowly sit down on the chair. Next, you will turn your body so that your leg is up against the side of the tub. Then, you will carefully lift the leg that is closest to the tub over the side of the tub. While you do this, you should lean back so as to not break your hip precautions. You may need to scoot over closer to the inside of the tub so that both of your legs will clear the side of the tub. Here is an example of how you would get out of the tub while maintaining your hip precautions.